Let's begin from where I stopped off with Dr. Asiobi, and let's delve into the particulars of case management now. As part of this national COVID-19 response strategy, we are having some level of mixed messages. At a point, we were saying, look, if you're positive, go to the isolation center, put yourself in quarantine, and so on. There have been developments. We are told that the virus is novel, so the facts about it keep changing. But that seems to give people mixed messages. Do you think at this point in time, our testing and case management strategy is right, given our environment?
Well, so far, I think we're on the right track, given the situation that we're in, and looking at the very fact that we are in a resource-limited nation. And I think what the government is doing through the PTF is worth commending, has been wonderful. What I think we need to do more is to look at the entire system and then audit the system and see where are we doing well, as against where we need to improve. Testing, yes, testing, we seem to have overcome the challenges associated with testing. We have a lot of laboratories now, more than 40 and counting laboratories. We have a lot robust private sector engagement, So testing doesn't seem to be a big problem. We have overcome the issues associated with manpower. A lot of medical laboratory scientists have been able to rise up to the challenge, and brought their professionalism to bear. So that is wonderful. Now, one area we will need to look at, while auditing the entire process, is the area of advocacy. How well are we doing with advocacy? And I tell you that that area needs to be strengthened. Advocacy needs to be strengthened. More eminent Nigerians, need to be brought forward, to be able to provide direction or provide influence over, some other persons to be able to get them to be tested. What I mean is this. You have, for example, the traditional leaders. How much have we engaged the traditional leaders to support this, fight? We have the religious leaders. How much have we been able to support the religious leader to engage in this fight? Remember, when we had the polio situation then, that when many people were rejecting, the vaccine, the traditional leaders played a lot of role such that people started accepting the vaccines. So we need to bring the traditional leaders on board. We need to bring the religious leaders on board. They have a lot of influence on their followers, both the imams and the pastors. They need to be engaged, in this fight. And then we also have the political leaders. For the first time, one will have thought that the political leaders will know what to do, but the scenarios that we see from certain quarters shows that we also need strong advocacy to even our political leaders. There are places where you find frontliners, sample collectors being turned back from some local government because the local government chairman is not aware that they were coming, and therefore could not provide the necessary cover for them to be able to do their national assignment. So a lot needs to be done. And I agree with my brother, the public health physician, that says we can bring up some of the celebrities to help join in this fight. If you have some of the people the youngsters look up to, celebrities come up and then also join in the fight against COVID-19, a lot will be achieved. So what I'm saying in essence is we need to audit the entire process and look at where are the missing links or where are the weak links, and therefore, put more attention on those areas with the aim of revamping them and making them respond adequately like we have other pillars of this thing response. So this is one area that I believe that we need to strengthen. But by and large,
I'm sorry, I have enough time. I have to jump in here and ask you. I have to jump in here and ask you, because of our time, about something else that the response strategy does not talk about, which is enforcement. If you look at some of the countries in other parts of the world, the PTF made reference to them today to say that even the countries where things are very liberal, they are now insisting, for example, on the use of face masks, and the non-use attracts a fine in some places. In other places, it actually makes you a convict. You are accused of a crime because it involves other people's health and so on. But our own response strategy doesn't really talk about that.
Yes, that must be a very gross oversight. And I think that we need to address that because it is important to get people to comply to safety protocols. If people cannot comply to safety protocols, then all the efforts that the PTF has been making, all the efforts that professionals have been making, will be effort in futility. Because the larger part of this fight is going to be personal. It is personal effort, my commitment and your commitment to the fight. The lockdown has been eased, but the virus has not, is still on rampage. So we need to be more circumspect. We need to enforce, the safety rules, the safety protocol for Nigerians. Otherwise, I tell you, they are not going to. We're going to have this issue linger for a longer time with us. So I agree very much that sanctions, should be considered for offenders. If you don't sanction, you may not be able to get the needed, response that you want from the populace. So this is very, very important, and I totally agree with it.
Moving to the issue of test kits. At the beginning of this, there was so much focus on getting Nigerians like yourself, lab scientists and so on, to bring their expertise to bear on the issue of developing indigenous or homegrown, depending on who you speak to, equipment and solutions to some of the problems. One of the things that has happened is that it's been announced that we now have an indigenous test kit. So it goes back to the issue of if you've tested only 200,000 people out of 200 million, part of the reason for that is likely to be cost. Does this indigenous test kit, for you as a lab scientist, change the game in any way?
Well, you are looking at something that has not been validated yet. So until it is validated, then we'll begin to have this conversation. Then secondly, whether we have the wherewithal to mass produce. Because it is one thing to have, the research conducted and saying, okay, I'm now able to do so and so. We have a kit that can test for coronavirus, whether it is a serological or ELISA-based kit or PCR kit. But do we have the capacity to mass produce this kit in country? This is one thing, we must also not shy away from. And instead of looking very far away, like I've always said, we have rapid test kits that we can deploy for surveillance purposes. And they are available. All we need to do is look at the ones that other countries are probably using. We validate them in country. Let's analyze their performance characteristics, their sensitivity, their specificity, and their accuracy. Most of them are expected for diagnostic purposes to meet 95% performance characteristics. So if we're able to validate some kits, we now catalog these kits into algorithms, sensitive kits versus specific kits. We catalog them into an algorithm, and then we deploy them for use. The serological kits are cheaper, so we will be able to test more persons with serological kits. More persons we can test for the IgM, okay, if we want to see how many people have acute infection. And this is something we can do. We should not be waiting for, only the PCR platforms to be deployed. PCR, of course, is gold standard. PCR has higher sensitivity, but for the purposes of mass screening, for the purposes of serological, surveillance screening, we need to deploy rapid testing, and as soon as possible. The statistics shows that we have not done more than 1,000 per million. That is grossly unacceptable for a nation that has 200 million, over 200 million population. So we must look at remedies that we can deploy that will help us, be able to raise testing level. It is when we raise testing level that we can isolate those people who are infected.
We have completely run out of time. Mr. Soji Billy-Rose, thank you so much for your perspective on the national response strategy. Mr. Billy-Rose joins us from our studios in Abuja. Thank you very much.